In the first episode, I have discussed the nature of the disease, and in the second episode, the pathophysiology of the hypertension. Then, in this session, I want to discuss about the treatment of the hypertension. In this session, I want to discuss the prevention and cure of hypertension. Hypertension is a chronic disease, so it is better to prevent rather than cure. In the prevention, the healthy diet is a very important part. Healthy diet. Next is regular exercise. Stop smoking. Restriction of salt in food, etc. I am going to discuss two strategies of treatment. Number one, decrease the peripheral resistance, and number two is the decrease the cardiac output. In the first category, the mode of treatment is the decreasing the peripheral resistance, and generally the medicine which are used in this section is number A, ACE inhibitor, and number B is the angiotensin 1, angiotensin 2 receptor blocker. In the first strategy, that is decrease the peripheral resistance, the prominent group of drug is ACE inhibitor. A for angiotensin, C for converting, E for enzyme. This is specially as enzyme which is generally inhibit the production of the angiotensin 2 from angiotensin 1. As we all know, angiotensin 2 is a potent vasoconstricting agent. That's why the peripheral resistance decreases, the vasoconstriction cannot take place, and there is a other group of medicine, that is angiotensin 1, angiotensin 2 receptor blocker. AT1 and AT2 must be attached with the receptor, but this receptor blocker will not allow the AT1 and AT2 to attach with its receptor. That's why the action does not take place. And there is another group of another way of treatment, that is decrease the cardiac output. In this category, the prominent drug are the diuretics, and beta blockers. The diuretics generally increases the urination. That's why the volume of the blood decreases, so the cardiac output is decreases. So this is the category of drug, and another category is the beta blocker. Beta 1 receptor is generally located in the heart muscle. If the beta receptor of the heart is blocked, then the force of contraction of the heart decreases, the stroke volume also decreases, so the overall blood pressure is decreases. So these are the method of treatment. These are the broad outline of the treatment of hypertension. So thank you everybody for listening us. with my English.